Welcome to Health Matters, a podcast presented by Wellmark, Blue Cross, and Blue Shield, where we invite Wellmark experts to discuss healthcare and health insurance topics that matter most. I'm your host, Kareem Amiri. Welcome, everyone. At Wellmark, Blue Cross, Blue Shield, our mission is to make healthcare better for our members, customers, and communities across Iowa and South Dakota. We have a responsibility to manage healthcare affordability for our members and customers. And since May is Mental Health Awareness Month, we are going to talk about that important topic today. And I have two returning guest stars, Cammy Jenkins and Dr. Matt Stanley, as we dig more into this important topic for the clients and members that we service. Dr. Matt, Cammy, welcome.
Yeah, thanks, Kareem. As you know, this is a topic that's near and dear to my heart, so appreciate the opportunity to talk about it.
Absolutely, and it's great to be back. It's my third time, so really excited to be back and to just talk about how we're advancing and how we're really listening to our customers and our clients, and excited to share some of the things that they'll be able to see moving forward.
Yeah, I'm really excited about that too. We foreshadowed some of the new things that are coming down the pike the last time we spoke, and prior times. I really appreciate you both coming back to join me on the Health Matters podcast. And it'd be really great if you could share some of those things that have occurred since the last time we spoke.
Well, Kareem, as we engage in this topic, when I look at trends across America, it's kind of helpful for me, at least in behavioral health, to look at our pre-COVID, COVID, and post-COVID world. And when I think of the trends that we were already experiencing pre-COVID, we had about 2 decades of rising suicide rates. And unfortunately, the fastest rise was in our youngest adolescents. We also were in the midst of an opioid epidemic. And in fact, in 2021, we saw overdose deaths in the United States top 107,000 deaths in a year. So, even pre-COVID, so we don't want to lose track of the fact that we had a lot of challenges. And then COVID came along, and WHO says that depression across the world increased 25% and anxiety 28%. And unfortunately, in the post-COVID world, we haven't seen a return to normal. Issues are still elevated, particularly in our adolescents. And some of the lessons we took into the post-COVID world is our youth are very vulnerable. When we took them out of schools and took them out of their peer relationships and support, we saw a massive increase in use of mental health emergency services. We continue to see elevated depression and suicide risk rates. But we also learned that virtual care is a reasonable and effective option, particularly in mental health. Not in all areas of healthcare, would I say, but I would say for mental health it's effective. And I also think the fact that we're having this conversation is one of those lessons we came out of COVID with. Mental health is a critical component of healthcare across the United States. It's okay to talk about it. And at Wellmark, we see the opportunity to try to improve, which I think is why, as we spoke about last time, I'm here. I was hired within the last year as a senior medical director of behavioral health. Well, thank you. And I'm very happy to be here. And I have the fortune to work with Cammy Jenkins. But Cammy, I'll turn it over to you, and you'll talk a little more about some of the things we're doing.
Absolutely. I think one of the things, as you mentioned, was just recognizing the importance of the need for behavioral health services. And so within Wellmark, really listening to our clients, hearing the concerns that they had, and then recognizing what we already internally had and seeing what gaps that we needed to close. And so that's where we really have been focused on looking at industry trends, understanding where clients are needing our help, and then looking at what we had and how can we close that gap.
Yeah, and to echo some of the comments you made already, the importance, like you mentioned, this is the third time you're here. I think that shows how important we believe this topic is. And from virtual utilization, I think our clients that are listening and employers would agree to that. They've seen, and we go out and we talk with them, that portion of mental health care, there's a high percentage now that is through virtual. So it's great that there's more avenues and creating more access for people, but access is still a big issue, I know. And so along those lines, I know we talked about creating an internal team in the past, and I believe that's now live. So if you want to expand upon that and talk about it a little bit more, that'd be great.
Absolutely. And as Matt said, he was the first addition to this behavioral health team, but really excited to share that we do have a dedicated team for our members. It consists of a team leader. We have 8 nurses who have experience anywhere from adolescents to adult in behavioral health and substance abuse, eating disorders, etc. Also have 3 social workers on our team as well. And so that team is dedicated to working with individuals, not only with their medical conditions, but with their behavioral health as well. And so just excited to have that team in place and be able to serve our members.
Yeah, I think it's great that they're here. I don't know, Dr. Stanley, is there anything you want to add about the team?
No, I think Cammy's done a great job. And just to be clear, Wellmark was doing a lot in behavioral health, and that team was already a concept and beginning to be assembled. So I think some of the things that I've been able to add with 30 years of clinical experience is just to work with those nurses and social workers. We have an interdisciplinary team meeting every week to talk about some of our more complex member situations. I've been able to work with medical policy as we try to stay on the cutting edge of where medical evidence is and, try to discern, I think, the best options for our members. But one of the most interesting things to talking about where we're at with the behavioral health team is our virtual care behavioral health committee that looks at just what we were talking about. The pandemic and even pre-pandemic, some of this is going on, but birthed a lot of virtual care companies, and particularly in the area of mental health. So we see opportunities there. Cammy talked about how we use analytics to try to identify gaps in care. And so it's a really exciting field, but you have to use some discernment because there's so many offerings out there. We want to make sure that we partner with the best. I'll give you an example, though, because you talked about access of care, and we know that it's nationwide. There's a shortage, and wait times are horrendous. I mean, I think the average nationally is like 48 days to get your first mental health appointment. We are even more challenged here in Iowa and South Dakota because of things like geography and equity. I mean, things that are just really difficult for us at Wellmark to overcome. But we were looking at gaps in care, and we identified a provider that serves intense outpatient for adolescents. So intense outpatient is defined as 9 hours of therapy, individual or group, per week. So if you're in, southeast Iowa or northwest South Dakota, you're never going to get that, right? It's only in our most urban areas, and even there it's scarce. But by partnering with this company, we can have adolescents get a group therapy experience with a highly trained professional and never leave their home, never leave that support structure, never leave their peers. So that is a tremendous asset, but that's something new that we can bring. We have to carefully vet these, and there are more offerings out there than we probably want to partner with, but there's opportunity.
I think in some scenarios, a lot of kids are maybe used to an environment like that already, as far as a video and, a room like that, I guess, with other kids at that age. Cammy, we go back to the team. Do you have any real life examples that you could share with us? I know in the past you've shared some, and now them being live, I'm sure that we've had a few instances here.
Yeah, absolutely. One of the things that is great about this team is that they are there to help and support members, and sometimes members don't even know really what they might need, but our team is here. People can self-select in if they need additional help. We also will do proactive outreach to individuals to engage them. So once individuals are engaged with our team, it really is assessing what is their need and how can we help them on our journey. In one particular instance, we had an individual that was in a residential care. They were receiving care for substance abuse and eating disorders. And as you can imagine, being discharged and needing support when they came back home, this was a young adult, and the mother who was her support was very anxious about her daughter coming back and not having the right support. Person had been in and out of treatment, and so it was really important to get the individual connected. that individual got connected with our team, gave permission to talk with the mom. And so the team was able to set up just a number of things, therapy for the individual, local AA, also got them connected to Doctor on Demand because they needed that service that they couldn't provide where they were at. And they said it was convenient and easy to use. So excited to have that. Also just medication management. And so the mom was super excited about that. And the daughter felt, and the member felt just extremely supported and didn't feel like they would need higher level care moving forward. So just a great example of how we are able to help and connect individuals where they might need it, and also provide that support to their family members as well.
That's fantastic. So they actually help them like make the appointments and
they
that
did.
sort of thing.
Yep,
That's
get
great.
them connected.
Yeah.
Can call providers' offices with them, can help them get appointments with Doctor on Demand. So really there to help them along that journey.
Yeah, I having been through something like that in the past, that's it's great to have that individual that's there that can help you through that. I know we've also talked about other enhancements and other things other than just adding a new team. Do you want to expand upon that a little bit?
Yeah, absolutely. I'll tackle a couple, and then Matt, I'll send it over to you. But just a couple things in addition to that is that we do have a dedicated line. So if someone calls in and wants to speak to our team, if they call into customer service or have a question, we can warm transfer them to the team. So I think that's a really cool thing.
That's just the way to access the
exactly
team.
Access the team. The other thing that was super excited, we know that one of the things that we've heard from our clients in particular, they want education. They want things when it's convenient for them, for their members. And so in early May, individuals will have the opportunity to go on myWellmark and do a self-assessment of 2 standardized behavioral health tests, the GAD-2 and the PHQ-2, and that assesses depression and anxiety. And from there, individuals will be able to then have additional education. They'll also be able to self-serve into the team. So if they want additional help, if they just not sure even what they need next, but they know they need something, they can self-refer into the team, and then the team will outreach to them.
Right. So they're in a digital environment. They can do that all online through myWellmark. And like you said, the team will reach back out to them.
Absolutely. Yep.
Fantastic.
Matt, I know we have a couple other things that we're looking at.
Yeah, I agree with you, Cammy. I'm very excited about the potential to even expand that at some point, but just adding that is tremendous. So we also have myEquilibrium, which is a product we've had for quite a while. That's geared a little more toward the member who wants to get on, as Cammy said, maybe has their own schedule, is comfortable kind of self-training or learning on their own. So that's a resource. We have the WebMD, the education and some kind of resiliency, coping skills, strengthening, mindfulness, a number of different skills you can access and training through that. And then some Doctor on Demand mental health coaching. So particularly I think if you're in that kind of moderate level of anxiety and depression and really need some skills, we do have Doctor on Demand for more severe psychiatric disorders. By severe, I mean, maybe need at medication level and some
you
of
can
the
schedule an appointment with a psychiatrist.
Absolutely right. Yeah. So really kind of all levels in there, everything from self-serve, kind of self-supportive to getting some coaching, getting some professional help to all the way to, licensed prescriber to assist you.
And I know the MeQ, WebMD, the Doctor on Demand mental health coaching, all those are things that, as an employer, they could talk to one of our account managers and get more information on. So,
right.
Awesome. One of the best things I think I want to remind clients as well is that this is all part of the core benefits. So it's not, we mentioned the MeQ, those other programs, those would be somewhat buy-ups, but the team, all these services on myWellmark, that is part of the core benefit package. Well, before we close the podcast, we've thrown out the terms mental health, behavioral health, and I know, Tammy, we've talked about it before, but maybe remind our listeners, are they interchangeable? Are they 2 different things?
I think they're used interchangeably a lot, but I do think there's some important distinctions there. So we talk about behavioral health. We talk about kind of the larger umbrella. So that is the mental health component, but it's also the environment you live in, the kind of the substances you use, even diet, nutrition. And it's a broader umbrella. Whereas mental health, really, we're talking about the medical component of it. So, and typically we're talking more about, the bipolar disorder, major depression, anxiety disorders. And then, substance use is another component of behavioral health, but again, often spoken of separately. So mental health is probably more what you'd see the psychiatrist for, might be hospitalized for, probably the most debilitating of those potential issues under the umbrella. Although substance use, we talked about the opioid overdoses, obviously has a very clear danger and mortality and morbidity associated with it. But I will say they're frequently interchanged, all those. So I wouldn't get too concerned if you misuse them, but I think it is nice to know the distinction and kind of helps. Again, you've mentioned it can be tricky navigating this world. Mm-hmm. And so sometimes that language does matter and does make a difference.
Right. And, I think, Cammy, if you could just remind people of some of the new resources that have launched this month. And how to access them.
Absolutely. First and foremost is we have a team. We have a team here who's ready, willing, just to, even if you don't know what you might need, they will help you along that journey. Also, we have the assessments on myWellmark, so the ability to go there, do some self-assessments, also get additional information at the bottom of the page. There's some educational resources, and also the ability to self-refer into the team as well. Again, just another avenue if you're not sure where to get started. As Matt had mentioned, it can be super complicated. We're here to help. We're here to help navigate and coordinate. So please utilize us. We're here, excited, ready to work with all the members.
Well, thank you both. I'm so proud of what we're doing at Wellmark, and as always, I want to thank you again for coming to discuss behavioral health and what Wellmark is doing to help our employers and members. Fortunately, our time is up today. I know we'll probably talk again because, as we noted, this is an important topic, and I'm sure we'll continue to evolve. As I noted before, for those of you listening, if you do have any questions and you'd like to explore this topic more, especially some of the services we talked about, please reach out to your Wellmark account manager. Thank you. So if you want to continue the conversation about today's topic, please reach out to your Wellmark representative. And thank you for tuning in to Health Matters, a podcast presented by Wellmark, Blue Cross, and Blue Shield. Take care.